The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
To start off, we're going to cover some general OT questions. Some of these might be a bit of a review of what we just covered in the slides, but it's always good to touch on the important points again. So, what are the most commonly missed signs of low T?
I'd say probably one of the more common ones is when you have bone density issues. So if someone's breaking or if they've fractured the long bones of their body, so sometimes like a tibia or a femur, in a relatively young guy or even a relatively healthy guy, that raises the question of early onset osteoporosis, low testosterone level. As we talked about, testosterone is very much involved in bone health. So that's probably one of the more commonly missed signs. So if that happens, we'll get a DEXA scan, we'll check the testosterone levels to see where those levels are at.
Alrighty, awesome. We're moving right along. Can testosterone treatment help with says importance, but I believe they're talking about impotence, so basically erectile dysfunction.
Definitely. In a number of ways. So purely from a hormone standpoint, the androgen receptors in your penis that are involved in blood dilation of the blood vessels to allow for more blood to come in and give you a stronger erection, there's androgen receptors there. So when you have higher testosterone levels, you're going to have more activity on those receptors, so stronger erections. Number one. Number two, from a libido standpoint, testosterone is very much involved. So when you have a stronger libido, you get more excited. More excitement leads to more blood flow leads to a stronger erection. So it kind of acts in two ways. So anytime someone has low testosterone, anytime someone is experiencing erectile dysfunction, I always check their testosterone levels because you could really benefit. You could really benefit them, or they could very much benefit from a boost in their testosterone levels to help with sexual function as a whole, libido, performance, erectile function, all of it.
Alrighty, right on. So next question here, what is free testosterone and what can be done if this is low?
Yeah, great question. So this is, so as much as we talk about total testosterone, free testosterone is more important, right? Your bioavailable testosterone. So testosterone lives in two forms in the body as bound and unbound testosterone. Unbound testosterone is the same thing as bioavailable testosterone. It's the same thing as free testosterone. We all have proteins in our body that bind the testosterone. That protein is called sex hormone binding globulin. You'll see SHBG. If sex hormone binding globulin is elevated, it binds more of your testosterone, so you have less bioavailable testosterone, and you won't necessarily feel all the benefits of your total testosterone that you have in your bloodstream. So free testosterone is ultimately what's important. That's a long-winded way of saying free testosterone is the most important form of testosterone. And how do we raise our free testosterone? Generally, so it's very difficult. I would say it's quite difficult to raise your free testosterone just by itself. By raising your total testosterone, you're going to raise your free testosterone. There's some scenarios where patients have liver dysfunction or they have other comorbidities. They have other health issues where their sex hormone binding globulin is elevated, and as a result of that elevation, they're binding more. So ultimately, I guess the best way of answering this question is to say there's no way of just raising your free testosterone as a whole. By raising your total, you're indirectly raising your free.
Alrighty, awesome. So next question here, a bit of a follow-up. I know we talked about general rule of thumb is pretty wide range of 300 to 1,000, I believe you said. But this question is, if I go above that suggested T level, so I'm assuming that's above 1,000, what risks and benefits would there be, if any?
So, no, that's another great question. So, It all depends on when you're checking your testosterone levels. So if you're checking your testosterone level the day after giving yourself an injection, it's always going to be super high. But that's short term, right? That's just a short term rise, and over the course of the next 7 days, it's going to decline. No harm there. There's no problem in that. However, if it stays elevated, the 12, 1500. So I have some patients who are bodybuilders, and they're doing 200, 300 per times, 200, 300%, 2 or 3 times the dose of what the average male will do. So the risk they run is a couple of things. The main one is we call it erythrocytosis, where I was talking about the blood clots. So when you have your testosterone levels are very high for long periods of time, you're producing more and more red blood cells. Red blood cells can thicken the blood, and thicker blood can lead to blood clots, heart attacks, strokes, DVTs, that kind of thing. So that's the main risk. So it's something to be mindful of. And we could always check that with doing regular blood work to make sure your red blood cell counts are normal. But that's the main risk you run.
Alrighty, right along. So I guess another follow-up, sort of. You said your testosterone levels would obviously be pretty high following an injection, but how about in terms of difference of morning or at night? When are your T levels most elevated?
T levels are highest in the morning, and that's why we generally tell guys to check your testosterone levels before 10 a.m. That's when it peaks. That's part of the reason why we get the morning wood, because our testosterone levels are highest in the morning, and it goes down over the course of the day. Yeah, morning is our highest testosterone levels.
Alrighty. Next question here. So this person asks, can you purchase testosterone online without a prescription, and is it safe?
So you can't purchase testosterone replacement therapy. So these online without a prescription. So so 3 of the 4 things we talked about, the gel, the injections, and the pellets, that needs a doctor's prescription. The supplements you could order online without a prescription. So you're not going to be able to order online. So there's no, you need a doctor's prescription.
Alrighty. Next question here about doing stuff at home. Is it possible to test your T levels at home? And if you're about to do that, how would you?
Yeah, so there's companies out there who will do at-home testing of testosterone. The technology is getting better and better these days, but there's Walkman tests, which are you prick the tip of your finger, you put it on you squeeze out as much blood as you can, you put it on a card, you mail it in. They're able to do an assay and get your testosterone levels. There's at-home blood testing where you're able to put it essentially different ways of extracting blood from your body and sending it in. But yeah, and offhand, I don't know what companies do it, but there's a lot of companies at home who do this at-home testing for testosterone levels.
Alrighty. We'll follow up with this question as well. To test your free testosterone levels, is that separate than testing your overall testosterone or total testosterone?
Yeah, so that's a different test. It requires a different order from the physician. It requires a different assay to be used. So if you're interested in seeing your free testosterone levels, you have to specifically ask for it, or you have to make sure that whatever order you're doing is looking for the free testosterone. Because generally speaking, when you're ordering testosterone, total testosterone, it doesn't have the free testosterone aspect to it.
Alrighty. Next question here. How long does one have to be under testosterone therapy? Is this permanent once you start?
Yeah. So testosterone therapy, generally speak, so there's 2 ways of doing it. Most guys, they get on it and they're on it for the foreseeable future, if not, forever, because they like it so much. The longer you stay on it, the more your natural testosterone making abilities shuts down. So if you come off of it, so if you come off of it, you're going to feel a dip while your natural testosterone production rises up again. So um, the easiest way of answering that is saying yes, you're going to be 95% of guys stay on it long term. That the other 5% guys, that what they'll cycle it. They'll be on it for 2 months, take 1 month off in order to maintain some level of natural testosterone production in their body, just because they don't want to lose that natural aspect. But that's more of a personal decision.
Alrighty, right along. So we've got a couple questions here. These are going to be reviews, but you know, it depends on person to person. But generally speaking, regardless of your age, if you're 66, 75, 50, what would be a reason to consider checking your T levels, or worry about your T levels rather?
What's the reason to check?
Yeah, so basically both these questions, they're asking what their T levels should be at a specific age, but I think it would be more important to focus on, you know, what would raise the importance of checking your T levels to start with, or worrying about it rather.
Yeah. You know, so this is a common question. So some guys, some guys will when they, as their testosterone levels are decreasing, some guys it's so gradual that it's over the course of so many years that they don't really notice a significant difference. But if they think about what they were when they were 30 and then where they are when they're 60, like, oh yeah, you know, maybe I don't feel the same. And then when you check their testosterone levels, you know, they're in the 100s or 200s, like really, really low. And when you boost up their levels, like, oh man, like I feel great. And that's the majority of guys. It's such a gradual decline of testosterone that they don't, um, it's hard for them to actually recognize that they have low testosterone. The other subset of guys, it's really like a steep decline where they're like, oh my God, like a year ago I was not like this. I feel so much, I feel something happens, a significant decline in my energy levels, my libido, my overall exercise performance, what have you. So those are the two ways guys, you know, kind of present with this. And then when you're talking about what your levels should be at, hard to say. But like I said, everyone, you know, my normal testosterone levels may be different than yours, and it's going to be different than a football player's. But generally speaking, you want it at least above 400. But that's less important than it is the symptoms that you're experiencing.
Alrighty, perfect. So next question here. This is a general all-encompassing question, but what are some of the long-term, or, you know, in terms of pointers and towards long-term safety when using TRT, I guess, is the question.
The safety of it?
Yeah, so I guess they're asking TRT long-term, is it safe? If so, why?
It's definitely safe. It's definitely safe if you're keeping a close eye on your PSA, making sure your prostate numbers aren't going up, and then the other thing is you want to make sure your red blood cell count's going up. In that sense, it's safe. I mean, the reason I'm hesitating here is because in terms of safety, there's nothing truly to be worried about as long as you're on the right regimen, you're not doing too much of it. The main risk with TRT really is if you're doing too much of it. You're doing an amount that's not recommended by your provider. You're going above that, because that's when it starts to experience these side effects like we talked about, the increased red blood cell count, leading to cardiovascular events. You're not monitoring your levels closely. Maybe your estrogen levels will go up because your testosterone levels are so high. So all it requires is close monitoring. Otherwise, it's incredibly safe.
Okay, perfect. Yeah, that definitely answers the question. I think we're just looking for, you know, what should these guys be doing while they're on it to make sure they're doing it right.
Yeah.
Moving right along. Next question. The question is, what is one of the best products for TRT? But I'm gonna reframe this. What form of testosterone replacement therapy do you see your patients using most commonly?
So the best form of testosterone replacement therapy is whatever fits your lifestyle. So that's the answer that I would tell you. Whatever fits the frequency of use. And some people's lifestyles, it's the gel. Some people's the injections. The most common one, at least in my practice, is the injections.
Alrighty. Right along. Those are pretty effective. So moving right through the question list. Next question here. This person says, what treatments are available for very low libido? Can testosterone replacement therapy help with this?
Definitely, definitely. If you have low testosterone levels and you have low libido, treating your testosterone levels, boosting up your testosterone levels can without question help your libido. Is it going to 100% solve it? I can't tell you for sure, but in the majority of situations, it will help your libido issues. If you have normal testosterone levels and you have low libido, that's a different story. But low testosterone and low libido, those two, boosting one will help the other.
Sounds good. Alrighty, next question here. This person is asking if there is natural ways to increase your T levels.
Yeah. So what's good for your heart is good for your testosterone levels. It's pretty honestly, this is honestly, if you want to break down overall health, it comes down to four things, excuse me. Eat right, like when I say eat right from a testosterone standpoint, well-balanced diet, complex carbohydrates, lean proteins. You want the healthy fats. You need the healthy fats in order to produce good testosterone levels. Sleep is huge when it comes to testosterone production. We've done studies where we've compared medical residents in the hospital, blood work for these guys who are sleeping irregular hours. The medical residents are sleeping irregular hours versus other hospital staff who are working regular hours. Testosterone, if you're sleeping 4 to 5 hours a night, you have a probably 150 to 200 point decline in your testosterone levels. So sleep is a huge one. You want to get at least 7 hours of sleep a night. This is the hardest one for all of us. But and then the third one is exercise. So when it comes to exercises for testosterone levels, you want to work out the complex. You want to work out the big muscle groups: your back, your chest, your legs. Heavy lifting of those muscle groups, not so much your arms, but your back, your chest, your legs will boost up your testosterone levels. We've done studies on that. And then the last one is stress, right? You want to minimize your stress. The same hormone that's involved in producing the stress hormone, which is called cortisol, that's the same precursor hormone that goes to testosterone. So that precursor that goes to stress will go also to the testosterone production. The more stressed out you are, more of that precursor hormone is getting shunted to the stress hormone, less of it's going towards testosterone, therefore lower testosterone levels.
Alrighty. Awesome. Next question here. This is kind of a follow-up to the one previous, but they say, I am on testosterone injections. My T levels are high, as well as my estradiol, but I still don't have any energy or libido. So they're wondering, I guess, where to look next.
Say the beginning again. T levels are high, but so is my estradiol.
Yeah, that was thrown in there as well. So it looks like the T levels are high or good, estradiol is up as well, and they still don't have energy or libido.
So one thing, I mean, without knowing what your numbers are, so there's a very sensitive balance between your testosterone and your estradiol levels. You want at least a 10-to-1 ratio, ideally 20-to-1 ratio between testosterone and estradiol. What happens is if your estradiol levels are too high, they compete with the testosterone, kind of negating the effect of the testosterone. So if you could see what that ratio is, sometimes putting you on a short course of a aromatase inhibitor that will increase the testosterone by decreasing the estradiol levels will help with what you're experiencing.
Alrighty, perfect. Couple more general questions here. So this one is, what foods would lower T levels, if any?
I would say that, so generally speaking, we say like soy products, like processed fruit. Again, this is like general things that are not good for your overall health. They're not good for your testosterone levels. But everyone's biology is a little different, so they act in different ways. But I would say stay away from ultra processed foods if you can. Stay away from soy products, because soy products could alter your hormone levels, increasing your estradiol, decreasing your testosterone. Yeah, I would say those two.
Yeah, right on. That sounds like a pretty good starting point there. Alrighty, so This next question here, this person's wondering if they start taking the testosterone, will they be able to hit the gym again like they're 30, quote unquote?
You'll definitely, depending on what your testosterone levels are, if they're very low and you boost your testosterone to a normal, high normal range, yeah, without, you'll be able to exercise a lot better than you are now. I mean, like you were 30 is all relative, but you'll definitely be able to exercise better than you are now.
Perfect. Alrighty, next question here. This person wants to know if testosterone supplement therapy can overstimulate your heart, such as having too much caffeine.
So the simple answer to that is no. I mean, there's been rare cases where patients have developed like they'll get atrial fibrillation after starting testosterone replacement therapy. So this is what I'm just telling you just anecdotally or based on things I've read, and I don't know. To me, just based on the mechanism of testosterone, it doesn't make sense that one would cause the other. But to me, it's as if they had this issue before and testosterone somewhat unroofed it. But it's not like it doesn't give you that. It's not like you're drinking a ton of caffeine where you feel amped in that sense. It's a very different type of energy. It's a very different type of excitement that you get, not one that you feel in your heart, but one that you feel more in your body, your muscles.
Okay, that would make sense. I wouldn't know, but sounds very relatable. Alrighty, so we're gonna move right along to some low T and fertility questions. So got a couple of questions here. These are, I guess, from my understanding, for men that are interested in preserving their natural fertility or natural reproduction rather. So right off the bat, what is the best testosterone replacement therapy for younger men who are worried about this?
Yeah, this is the most important question we ask when someone is who has low testosterone and wants to get treated is, are you interested in having kids, or preserving your fertility? And if the answer is yes, then you really are limited to two options. One of them is called Clomid or clomiphene. It's an oral pill that in a long-winded, in a way, again, tells your testicles produce more testosterone, naturally boosts your testosterone levels, doesn't override your system by any means. The other option is something called HCG, which does the same thing, but this is an injection every other day as well. The HCG is stronger, but the Clomid, either one is a good option. We generally start guys on Clomid because it's easier to get and it's cheaper.
Alrighty. So that answered both the questions there. The follow-up was other than Clomid, so we have both of our fertility questions taken care of. So we're gonna go along into some testosterone replacement therapy methods, I guess. That's just what I titled these, but these are more specifics on the different treatment methods that we went over. So I'm gonna start off with pellet questions. How big is the cut or incision to put the pellets, or insert the pellet rather?
It's like half the size of my nail, my pinky nail. The width of my pinky nail. It's tiny. It's tiny. I would say like it's 3 millimeters, 4 millimeters. It's tiny.
Alrighty, and just to follow up to that, and in your practice, or generally speaking, what rough percentage would you say men use pellets as their form of TRT?
I'd say about 15 to 20%.
Okay, pretty decent. We're moving right along. So another pellet question, is the testosterone pellet procedure an outpatient procedure? This person's wondering if they could go to work the next day.
Oh, absolutely. It's done under local anesthesia. You don't feel any. I mean, once you're numb, you don't feel anything. It's very, very well tolerated. You go back to doing whatever you're doing that same day as soon as you walk out of the office.
Pretty convenient.
Yeah, super convenient. The pellet placement takes maybe 2 minutes.
Oh wow.
If that.
So another pellet question in terms of where to get it implanted. Where's the best location to have your testosterone pellet placed?
The upper buttocks, because it's a big area of subcutaneous fat, and it's there's not a lot of contact with it. You don't necessarily sit on that area either. You sit on your lower buttocks. So your upper buttocks is just safe from contact, and there's a large area of subcutaneous fat that the pellets can reside in.
Alrighty. Moving right along, next few questions will be about the gel. So can you apply the testosterone gel over tattoos?
Yes, you can, and it shouldn't impact its absorption. Yeah, it's okay to do it over tattoos. If you could avoid doing it over the tattoo, ideally, you could put it on another part of the arm or shoulder that doesn't have a tattoo. But if that's the only place where you could do it, it's fine.
Alrighty. And I know we talked about, being cognizant of where we apply this gel so that we don't transfer it to anyone. So would you recommend applying this gel to your thighs?
You could. Yeah, you could apply it to your thighs. With it has similar absorption, but it depends where on your thigh. But yeah, applying it to the thigh is fine.
Alrighty. And looks like, okay, we got a couple more. So this will be our second to last gel question. So how long does it take to notice the results from the gel? Is it the same for, most other TRT treatments?
The penetrance of the gel is a little weaker, so it probably takes maybe like a week roughly in order to start feeling it. Whereas the injections takes anywhere from about 24 hours for the injections, but the gel takes some time because it's weaker penetrance.
Alrighty. So next question here. This person says they've been applying their topical testosterone cream, which is the same as the gel, onto their scrotum, which is what they believe they were supposed to do, but they recently read that this might be a bad idea. They're just looking to confirm if this is what they should or should not be doing. Yeah,
don't apply it to the scrotum. You don't want to apply it to the scrotum because of the proximity to your testicles, also the scrotal skin. So the reason why we say that the shoulders, right? The main reason why we say the shoulders is because it's a hairless part of for most people, it's a hairless part of the body. Now, that's the key. You want to put it on somewhere where there's not a lot of hair because the hair could, basically stick to some of the gel and it decreases the absorption. So if your thighs are hairy, avoid the thighs. The scrotum, generally for most guys, it's hairy. So avoid the scrotum too, but it's proximity to the testicles, it's hairy. You want to avoid it.
Alrighty. Got a couple questions here about the testosterone injections. So a bit of a review here. What needle size is recommended for testosterone cypionate?
So you want to draw it up with an 18 gauge needle, which is a thick one. So it's a thick oil. That's the thing. The testosterone is a thick oil. So you want to draw it up with a thicker needle, an 18 gauge needle, and then you want to inject it either with a 21 gauge or a 23 gauge.
Alrighty. Right along. Next question here. What is the best injection site for testosterone cypionate?
Some guys will do their thigh. Most guys will do their buttocks. Some guys will even do it in their subcutaneous belly fat, like, right here in the abdomen. Because some guys will do it subcutaneous fat, which is fine. IM is what we recommend, but some guys will do it in their subcutaneous fat. But those three areas, the two most common areas are subcutaneous fat or upper buttocks, kind of similar to where we put the Testapel.
Alrighty. So we briefly talked about, post-prostatectomy and how the prostate affects testosterone levels. So these will be a little bit of a review, and we have some in the chat that we'll cover as well. But after a successful radical prostatectomy, I still have some ED after 5 months. Would testosterone replacement therapy be an option 5 months post-surgery?
Yeah, it depends on, there's some layers to that. Part of it depends on your pathology, how your final pathology, your Gleason score, whether there was any, if all the tumor came out or there were some positive margins, high grade, low grade. There's layers to that question. But generally speaking, we try to wait at least 6 months, sometimes 12 months before starting any form of testosterone replacement therapy after a radical prostatectomy.
Alrighty. And then This one is a bit of a review, but pretty important to cover again. So what effects does the prostatectomy or the prostate have on a man's natural testosterone levels and production?
Long term, it has no impact. The testicles are independent organs. They produce testosterone. They're going to keep producing the same levels of testosterone. Shortly after surgery, we all experience a drop in testosterone. That's normal. But like I said, long term, it has no impact on your testosterone levels.
Alrighty. So moving right along into some more questions here. These might be a little more specific. So saw this a couple times, whether it was testicle atrophy or just talking about testicular loss, or rather if there's any way to reinflate the testicles. So maybe we could just cover those all in one go. We could talk about the testicle atrophy that could be possible and what can be done to reverse it, if anything.
Yeah, because testosterone replacement therapy is shutting down testicular function. For some guys, they atrophy. The testicles are going to decrease in size for most guys, and some guys it's more noticeable. And this bothers some guys. They want something. They want some testicular size. So what we do for those guys is we put them on HCG, a somewhat higher dose of HCG, just once a week. That's an additional injection. You inject yourself once a week with HCG, and that maintains your testicular size. It doesn't necessarily grow it back, but it maintains it.
Alrighty, perfect. Next question here. So this person says that testosterone gel that they're on normalizes their current T levels, but however, their free testosterone remains low. How can you boost that specifically?
Yeah, that's a tough one. There's ways in which you could lower what we say is like you could lower your SHBG really by getting healthier. I would say start there, getting healthier, exercise more, eat better, eat cleaner. That can help lower your SHBG. There's some supplements that can help lower SHBG, boron, and then there's other forms of testosterone replacement therapy that will boost up your free testosterone. Some of the oral testosterone replacement therapies, but those are newer and those are a little bit different. But first and foremost, get healthier and see what that does to lowering your SHBG.
Alrighty. Next question here. Is testosterone replacement helpful for men diagnosed with osteoporosis?
If your levels are low, if your testosterone levels are low, yeah, it could help. If your testosterone levels are in the 500-600 range, like right in the middle of the pack, it's probably not going to impact your bone health in that sense, because it seems like it's okay.
Right on. Alrighty, got a couple questions in the chat about testosterone replacement and blood thinners. So is there any contradictions there or worries to be had?
No, I mean, the main one thing to be aware of, if you had a cardiac stent, if you had any kind of type of cardiovascular event or the cardiac procedure in the last 6 months, try to avoid part of our guidelines are to not put you on testosterone replacement therapy. But if you had a procedure and you're on anticoagulation 2 years out, 3 years out, it's okay to be on testosterone replacement therapy, not a problem.
Alrighty, next question here. Can testosterone replacement therapy help overcome difficulties in late ejaculation?
It can. It definitely can, because what it does is it makes the erection stronger. Stronger erections when you have a stronger erection, the delayed ejaculation can be improved.
Alrighty. Moving right along, we're getting to some of the ends of our questions here. So this one came up, you covered it briefly, but maybe we could cover it a little bit more in depth. So what's your personal take on adding HGC therapy to testosterone therapy? I know we just talked about the atrophy a little bit.
Yeah, if you're trying to preserve fertility or you're trying to preserve testicular function, preserve testicular size, absolutely, absolutely, it's a great way of doing it. If you go on testosterone replacement therapy by itself and you want to have kids down the road, I generally tell patients it takes about 4 to 6 months for your testicular function to come back. If you're on HCG while being on testosterone replacement therapy, that 4 to 6 months is going to be a lot shorter. maybe as little as 1 month. So it does preserve testicular size, testicular function, and preserves fertility.
Alrighty. Got a couple more enclomiphene questions here. So how do you view enclomiphene in terms of helping to stimulate endogenous production of testosterone?
Like we talked about earlier, it's great. It's a great, it's the cheapest, easiest way of preserving fertility while also boosting testosterone levels. So you preserve your fertility, you naturally tell your testicles to produce more testosterone. You're usually on it for anywhere from 3 to 6 months, and then you could come off of it.
Alrighty. Got a couple more general questions here that we can ask. So why is it that testosterone levels decrease instead of increase with age?
The testicles are like any other organ in the body. They're not going to function the way they used to when you're young. Your heart, your lungs, your kidneys, your liver, your brain, all these organs, they start to decrease in function. Testicles, they have two functions, testosterone and sperm. Same thing. Those two functions are going to decrease as you age.
Certainly. Okay. We're almost out of questions here. So next question we got here is how often should your blood work be done when you're on TRT?
At the beginning, I would say every 2 to 3 months, just to make sure your dose, you want to find the right dose for you. But once you found the right dose, your PSA is good, your CBC is okay, your estrogen levels, your testosterone levels are all at a good place, and you're feeling good, you could start checking blood work every 6, 12 months. But at the beginning, like anything else, you want to do it more often just to find out your sweet spot, and then you could span out the visits.
Alrighty. Yeah, just had a couple more come on in. So let's talk about this one here. Why does some of my testosterone change to estrogen when I take, excuse me for this pronunciation, but it says Arimidex, the estrogen drops and the testosterone increases?
Yeah, so testosterone, it really exists in 3 forms in the body. It exists as testosterone. So testosterone gets converted, it stays as testosterone. It gets converted to a hormone called DHT. DHT is what enlarges the prostate and causes male pattern baldness. And then the other form is testosterone gets converted to estrogen or estradiol. That conversion takes place in our fat cells. There's an enzyme in our adipose tissue or a fat called aromatase, and that converts the testosterone to estrogen. When you have more fat, you're going to have more conversion, so your testosterone levels will go down and your estrogen levels will go up. And as I talked about earlier, you want a 10-to-1 ratio between your testosterone and your estrogen. So the way you stop that conversion is there's a medication, there's an enzyme blocker called aromatase inhibitor. It blocks that enzyme so that the testosterone is not being converted to estrogen at the same rate. Therefore, your testosterone levels will rise and your estrogen levels will come down.
This patient says they've been on testosterone cypionate 200 milligrams for over 10 years, and they're wondering when choosing a testosterone replacement therapy, should they avoid synthetic testosterone / Clomid is what they asked. They're wondering if they should avoid some of these newer options, or would it be safe to continue what's working if it's working?
It's safe to continue using what's working if it's working. Yeah.
Alrighty. Yeah, that would probably be best. So looks like this is actually going to be our last question. So this question here, oh, sorry, we got 2 more. So second to last question, is skin flushing or redness common with TRT?
It can, if your red bloods, again, back to the erythrocytosis or red blood cell production, if your red blood cells are quite high, you'll get more flushing, you'll get more redness. So if I see a guy coming in who's on testosterone replacement therapy and he looks like he's been in the sun all day and it's January, I worry about his red blood cell count. So I do have to check that and make sure. So it is something that we have to be very mindful of.
All right. This will be our final question for tonight. It's a very good question. So how does testosterone levels affect libido with someone that has a penile prosthesis?
It still can affect libido just from a desire standpoint. So testosterone, as we talked about earlier, it addresses libido issues in two ways. When a patient has an implant or prosthetic implant, it's not going to really help with your erections, but just from a mental stimulation, drive, excitement standpoint, it has a huge impact. So if you are having low testosterone levels and low libido, boosting your testosterone levels can really make a big difference in your libido.
There are more resources on the Resource Center on menmd.com. You can visit this page and find instructional videos, guides, expert articles, and more. If you heard about or would like to learn more about any of the treatment options that you did hear about tonight, you can do this by going to menmd.com, navigating to the low T condition page. You'll scroll down and look at the lists of all the low T treatment options, and you can select up to 3 of these options by checking the box and clicking compare. You can also call MenMD at 857-233-5837 or log into the MenMD portal, and this will allow you to schedule an appointment with a personal health assistant who can further guide you in your TRT journey or answer any follow-up questions you may have.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.